StandFast community, Katie Copeskey here, your Senior Vice President of Programming, doing a very important and very timely interview today with a friend and colleague of mine, Captain Aimee Robertson. She is a licensed clinical psychologist for the U.S. Army. I met her while working in the behavioral health clinic at Tripler Army Medical Center, and she has recently moved to Fort Bragg, North Carolina, where she's operating embedded in a unit as a behavioral health officer. And today we're going to be discussing, like I said, a heavy and important topic, but also shining the light within that as well. So we're going to be discussing post-traumatic stress disorder and also the other side of that coin, post-traumatic growth, which for a lot of people is a new concept. People haven't heard about this idea of not just bouncing back when we think about a resilient person, but actually taking stock of a situation and having a different outlook on life. And that's part of the components of post-traumatic growth. So why I think this is so timely is we've been hearing about the mental health implications, the mental health impacts that we're having to deal with going through this pandemic. And what we may not be hearing so much about is the specific impacts that our first responder and our military community is going through. And let's be honest, this is already a high stress occupation, right? So I was doing some research on the first responder community. Since Aimee and I both come from that military background, it's pretty prevalent that people are comfortable and talking about having the conversation about post-traumatic stress disorder. But I wanted to dig in a little bit more on the first responder side. And so some of the stats that I found were really interesting in that there is also this extra prevalence of PTSD, depression, suicide ideation, and substance abuse within this community. And again, that's just within the normal day-to-day context of being a first responder, which makes sense. I mean, these are the people that are showing up to those crisis moments in people's lives. Now let's take stock and add in a pandemic. Let's add in protests. Let's add in wildfires, hurricanes. I mean, so the amount of extra stuff that's happening right now makes sense that we're having this conversation today. And I think that it's so important to be having this discussion. So I'm super grateful for Aimee's time today to share her experience, her background, and really gain more awareness about post-traumatic stress disorder, and then also talking about post-traumatic growth. So thank you so much for taking some time to be with us today. And please give us a little bit of your background, your history before we tee up into this conversation.
Thank you so much for having me. I really appreciate, I'm honored that I get to be here and speak on this topic. It's pretty close to my heart and, like you said, very, very relevant today. I am a clinical psychologist and a captain in the U.S. Army, as my good friend Katie said. I started out my career with a background in community mental health and then moved more towards military and the DoD. And of course, I joined the Army, became a captain. I currently work as a psychologist in my brigade at Fort Bragg, like Katie said. And most recently, my role was to respond to medical providers dealing with COVID and patients who had COVID, and seeing how they respond in this pandemic, but also caring for the caretakers.
Yes, awesome. And such a valuable thing to be able to provide, right? I mean, we've been also having conversations about like the burnout rates of mental health providers right now and having to help people sort of navigate through these really stressful times. So being an advocate for them and being a resource for them is super, super amazing as well. So let's start to dive into this conversation about PTSD and really like kind of clear the air about what is defining a trauma and what are normal responses to a traumatic event?
Yeah, absolutely. So for trauma and PTSD, trauma is really subjective. And what that means is that each person experiences what could be the exact same event differently. So different people have different reactions. Some people can come out of a very scary event and be completely fine. And some people can come out of an event that seems less scary to some people and be completely jarred and thrown off balance by it. And all of these reactions are okay and are normal. And when we talk about PTSD, what that means is that you have a normal reaction to an abnormal event and it has carried over and it is extended longer than the typical response and typical kind of like cool down time almost. So trauma, being that it's so subjective, can really be anything. It could be natural disasters, fires, hurricanes. It could be pandemic. It could be things like some very severe accidents, or like different things such as torture and assault and kidnapping and robbery, things like that. So really, there's a very large spectrum of what trauma is and what the response can be for trauma.
Yeah, and I've been on a few different PTSD related studies while at Tripler, and I think the range that you're talking about is important, right? I think a lot of times, especially when we think about the military, is that PTSD is very much always tied to deployment. But there is this wider range that you're talking about in that people might have this response to something that's not deployment related, but it's still traumatic, right? Um, and then within the first responder community, I mean, these are people that are seeing and dealing with like injuries themselves or in others, life, like loss of life, life-threatening injuries. So it makes sense when you think about all of those different categories or all those different types of traumas that being a first responder or being a person in our military, this might be a higher prevalent rate because of just that exposure factor. I also really appreciate the normalizing of this this normal response to an abnormal environment. I think that's so important that there are these typical, let's call them symptoms, there are these typical responses. It's when those responses last for a longer amount of time or it's not able to be managed is when we need to be on the lookout. So do you mind talking a little bit more about what are some of these quote unquote symptoms? What are some of these responses that people tend to have post a traumatic event?
Absolutely. So there's a wide range of responses. It can be anything from the typical fear and feeling like jittery or on edge a lot, difficulty sleeping. It can be anger or kind of questioning our existential things and even questioning our beliefs sometimes coming out of it. It can be a lot of sadness. It can be a lot of isolating and loneliness and feeling like people don't understand unless they've gone through it. And it can even be two people who have gone through the same experience can come out of it different. And then one feels more isolated from the other because they're responding differently. We can have a lot of avoidance of things that remind us of the situation. And we can have very like intrusive thoughts or memories or disturbing emotions and arousal around the event. It's a wide range, and sometimes you even have some numbing or some feeling like you don't feel anything after it, and very wide range of reactions. And it just depends on the person and the event.
Yeah, that's great. I appreciate all of that. The other one, that I would hear about too would also be nightmares.
Right.
So not only obtrusive thoughts like during the day and not being able
Yeah.
to have a sense of control over those thoughts and those flashbacks, but then also interrupting sleep, like making it hard to sleep, but then also showing up in dreams as well. So sleep tends to also be something that's very difficult for folks to capture whenever they are going through this process as well.
And sleep can be impacted on multiple fronts too, because you have nightmares, which wake you up and disturb your sleep. And then you have these intrusive thoughts where you're laying in bed and you're just thinking and your brain's just going and going. And you can get like a double hit sometimes. You're woken up from the nightmare and then you can't fall back asleep because you're just going and going and going and going.
Right, absolutely. Yeah. So what I appreciate about all of what we're talking about when it comes to the symptoms is that there are these like buckets or these categories, right? So we're seeing the mental impact, the cognitive impact, the emotional impact, and then the body impact as well. So it's interesting. I was reading an article whenever I was first getting into PTSD research, and they were looking at it not only as a like mental health issue, but also a physical issue, and thinking this as an injury, because PTSD is different than generic anxiety. There is a more elevated arousal component to it that can happen. And so I'm curious if we can kind of shift in a little bit more to what are some treatment options when people are realizing like, hey, this has been lasting me longer than normal. And maybe you can kind of give us a spectrum of what normal might be. And then like what to do next once they realize, hey, like I might need some extra support with this.
Of course. So, as far as lasting longer than normal, keep in mind every person is different. And in order for it to be a disorder, it needs to be roughly, the time is roughly a month after the event, but you need to be removed from the stressors of the event as well, which is an important thing to keep in mind. So, if you think about, when you're, say, running from a tiger, which we're not doing anymore, you're running from a tiger and things are crazy and you're like, oh my gosh, let me get to safety and close the door. You're in your cave that has a door now. So you're in your cave, you close the door, you're safe. So 1 month after you are fully safe and you know that tiger is not getting in, then if you're still having these things, then it's something to kind of look at. And it's something to be aware and say, hey, I'm physically safe, but I don't feel like I'm physically safe.
Mm-hmm.
Then that's when you need to start thinking about it. Also, keep in mind, this is based on research, but as a field, we had to pick a number. So it's a little bit of an ambiguous time frame. So you could say, okay, well, it's been a month. Okay, but it may or may not be normal still. If you're feeling like you can't feel safe when you're in a safe situation and you know that you're safe and it's been a persistent problem, you should go and get some help. Go take a look at it, see what's going on. So that's what we're normally looking at. But then what if you go and you're not safe from the tiger? The tiger can get in your cave, which is more akin to today. And we have a global pandemic going on, which we're not safe. There's danger around the corner. It's a persistent thing. This is similar to first responders. They go to work every day still, and every day they're seeing these things. And it's a persistent thing that is not subsiding, which is something to really keep in mind when you're thinking about different symptoms and is this problematic or is this normal? It's very difficult to say, but if you're feeling different than your norm and it's persisting longer, and even inside of these stressors, you're not able to find any balance, then it's time to take a look. So typically, even when there's the stressor is still going on, our bodies figure out a way to cope, and we figure out how we can get a little bit of normal even in this. I've heard the phrase the new normal a lot. So similar to that, if you can't find your new normal and you are still feeling unsafe continuously, but more so than the person next to you, then it's time to take a look and say, okay, I know that this is a very persistent thing and none of us are completely safe right now, but how can I get some peace in this?
Yeah, I think that's a really great recommendation. So what I love about what you're bringing up is this importance of self-awareness and really being able to take some personal stock and say, how am I really doing with this? And am I really coping in a way that's helpful? We posted a video last week about the ABCs and that being a way for us to kind of check in on our responses and like, how am I doing with that? And so like, this is a nice nudge back to that. But also, I think something that I've heard in speaking with folks that have PTSD is sometimes they're not always like have enough awareness, but their partner does, or their friends do, or someone else is coming to them and saying, hey, like I've noticed that things have shifted for you. I've noticed that, you are having bigger outbursts. You are, not responding very kindly to other people around you. So can you maybe talk a little bit more about how others might act as an indicator for us as well?
Absolutely. So that's also a really big piece of this is in order for it to be a problem, like a diagnostic problem, there has to be some form of impairment in functioning. So I see a lot people coming to me saying, "Hey, I don't think I'm impaired in functioning. Everything's fine. I'm great. It's just my significant other says this, and this, or my friend said this, and this." So sometimes we're not able to recognize it in ourselves. And when our social support system is saying, hey, something's awry, that's another indicator that this could be a problem. And it's important to really evaluate and look at that because our social support systems are also a huge piece of recovery and even post-traumatic growth. So if your social support system is saying something's awry, then let's take a look.
Okay, Amy, so we're getting into talks about actually seeking treatment. And that can be kind of a big ask for people because within both of these environments, the military and first responder, and it's something that we have talked about a lot, is there's a lot of stigma that's attached to seeking out behavioral health support. And there are lots of messaging that you're considered weak, you are, going to be having some impact on your career. And so there's a lot of barriers to people actually reaching out for that support. So can you kind of talk through that?
Absolutely. So, the first thing that I'm going to say is that it's very, very important if you notice that there is an issue and you know that you need support on it, it's very important to nip it in the bud early because it's going to be a quicker course of treatment and it's going to resolve easier and quicker and get you back in the game faster. And it's going to be less of an impact on you overall than if you wait and let it stagnate and then it turns into this big wound that is just debilitating down the road. That's going to be much worse for you than if you get it taken care of early. And on the military end of things, there is a lot of stigma about impacts on career and potential like risking certain jobs or certain special schools, things like that. And along those lines, if you do get it taken care of early, there's going to be much less of an impact on you than later down the road. A lot of times the loudest stories that you hear are the most intense ones. And a lot of times, if there was a lot of impact to a career based on behavioral health treatment, things like that, those are the stories that you tend to hear the most. So there's a lot of hidden success stories. And if you think about this, it's kind of because of the nature of behavioral health, I'm willing to say. So as a behavioral health provider, I provide a certain level of confidentiality. On the military end of things, it's very nuanced and if we were, if, for example, you were my patient, I'd go more into depth about what that confidentiality means. But for the nature of this discussion, I'm just going to broadly say there's levels of confidentiality where I'm not going to broadcast the success stories because I'm not going to put my patients and clients at risk of feeling unsafe coming to me because I'm going to tell their stories. So if somebody comes to me and they're doing very well in treatment and it's not impacting their job, things like that, they're not willing to discuss it with their coworkers or with their battle buddies, things like that. These are success stories that you don't hear of because they came to treatment, things went great, they moved on with their life. So you've got these hidden success stories that that are very powerful, but also not shared. So there is a fear around coming to treatment because of the not success stories that you hear that are the loudest, even though they may be the fewest.
Right. So it sounds like there's this big imbalance of, you know, what's being put out there versus what actually is. And ultimately knowing that taking care of yourself is the most important piece. I think in the military, like, even if you are physically hurting, it's still like difficult to take that knee. And so that gets broadened to the mental health side as well, when really, in order for the force to be strong, right, in order for people to be both ready and resilient, they need to be taking care of themselves, like physically and mentally. And so I hope that that message is something that people start to hear more often and take more to heart than some of these negative stories that are getting broadcasted much more broadly.
Absolutely. And a message that I really hope gets out there more is that behavioral health and physical health are one. This is all your medical readiness. So if you have a broken leg, a medical provider is not going to tell you to ruck on it. And chances are your battle buddies don't want you to ruck on that broken leg either. So this is the exact same with a behavioral health issue. If you have that behavioral health issue, don't try to power through it. You do need to take a knee and get that fixed up so you can get yourself back in the fight.
Nice. So then let's say the lunge, right? So I'm going to, if I'm in the military, I'm going to go see my primary care provider or self-referred to behavioral health. If I'm a first responder, I'm looking for a mental health professional in my community. Peer counselors are something that I know that they have access to as well. So walk me through, like, you know, this might be people's first time interacting with behavioral health. Like, what might this look like? Let's sort of like paint a picture of some expectations of what treatment options might look like, or what a counseling session looks like.
Absolutely. So on the military side of things, there is a I like to think of it as kind of a pyramid. So the what do you do first? We've got our buddy aid. So go to your battle. Say, hey, something's awry. What's going on? Is this something that you can figure out within your social support system? Is this something where if you rely on your social support system, talk it out a little bit, lean on some friends, and then things clear up for you? That's great. If not, let's take it to the next level. So we've got a lot of different options, and it depends on what community you have access to of what your options are. But take a look at that and see, is there a maybe not quite medical yet for, like, is there like a peer counselor? Is there like maybe chaplain that you want to talk to? Things like that. See, is this something that can get cleared up with just the next level of support? If not, all right, we still got the rest of the pyramid. So then that's when, on my end of things, that's when you come see me at Behavioral Health. And that's when we would do an intake, and we would say, sit down with you and do kind of like an interview style of, hey, tell me what's going on and give me some specifics on what's bothering you and what that looks like for you. And then we would together pick some different treatment options and then select what's going to work best for you. As far as PTSD goes, there's a lot of different trauma protocols that have shown a lot of success when our when our individuals are fully engaged with them. Some of the problems around PTSD specifically is the avoidance piece of it. It's very, very difficult to engage in treatment because you're dealing with potentially the scariest event of your life. And we're asking you to do the second scariest thing, which is relive it with me staring at you. So it can be very, very scary. And that's when it's really important to reach out to your social support system, get support after a particularly difficult session. Let your behavioral health provider know that it's difficult for you and see, is there a way that we can crawl, walk, run? Can we make this a little bit easier here? Is there anything we can do to make this more doable? The best treatment in the world does absolutely nothing for us if you can't engage in it. So let's make it a little bit more digestible. Let's help you out there. So that's something to keep in mind. As far as specific treatments and specific protocols, there are a lot of success around exposure-based therapies, which are, to name a few, there's cognitive processing therapy. Then there's also prolonged exposure therapy. There's also written exposure therapy, which can be more helpful. In these different exposure therapies, they're going through the trauma so that your brain can digest it and put it in categories to organize it in your brain so that it doesn't pop up. So it's trying to scare you all the time. It's a way to categorize it and put it in its place in your brain so that you can move on with your life and not have things just like, wah, 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 coming out of everywhere. So as far as those options go, each protocol is a little bit different. Like I said, there's a written version of it versus the protocol where you talk through it, things like that. So work with your behavioral health providers to understand what's going to work for you and what the different options are. There's also other types of therapy. For example, we have EMDR, which is another option. There's art, there's ACT, there's different types of therapies. So if the exposure-based therapies are pretty scary and don't sound like something that can really work for you, there's a lot of different options. Just talk to your provider about what can work for you and what each one entails specifically.
Yeah, I really like this collaborative, like dance almost that it sounds like, right? It's like, hey, here's this like menu of options, like which do you think that you are ready for? And if we're not ready for that one yet, we have other options. So why I think that message is powerful to send is that it is empowering. It says, hey, if first you don't succeed, try again. We have different modes to figure this thing out to where it's something that is more manageable. You have more coping tools and you have more brain structure, so that these flashbacks, these nightmares, these intrusive thoughts, that is sort of de-escalating over time.
Definitely.
So yeah, that's really, I hope that allows other people that are watching this video to feel more hopeful and to feel inspired to know that there are a lot of different options out there.
Yes, and something really important to remember that you touched on a little bit is that dance, that relationship with your behavioral health provider is so important, because research has shown us that one of the best predictors of therapeutic outcome is the relationship you have with your therapist. So don't be afraid to voice what's working and what's not working, because if something's not working, just sitting and dealing with it is not going to be helpful for anybody. Don't be afraid to shop for therapists. You might be a little bit limited depending on the system that you're in and based on availability, but if a therapist or a behavioral health provider isn't working for you, that's going to impact your treatment, and that's going to impact how quickly you get better and if you get better. So I really encourage you also to keep an open dialogue with your therapist, and then if something's not working, try to work it out with them first, and then see maybe is there another option if it's not something that you two can get over.
This is such an important point to bring up. I'm so glad that it's come up. When I was volunteering as a crisis counselor for Crisis Text Line, one of the questions that we would ask is like, what is your current support system? What does your current support network look like?
Yeah.
And I was actually surprised by the amount of people that had a therapist or a professional counselor that they were seeking treatment from. And so I would say, oh, tell me a little bit more about that. Like what are you guys talking about? What's working for you?
Yeah.
And a lot of the time people are like, oh, I don't really like my therapist. I don't feel heard. I don't really look forward to going. It's not something that I feel like I'm getting very much out of. And I'm thinking, like,
Yes.
why, that's got to be expressed. And so I appreciate from your perspective, Aimee, you're welcoming that invitation to say, hey, give us that feedback. And if this really isn't working out, if my style isn't jiving with you, shop around, because that
Yeah.
relationship is so critical. So that's such a valuable point to bring up. So thank you for mentioning that.
Of course, absolutely. Super important.
And then one of the things that I was curious to know about too, that I think our audience is also interested to know about, is with these different treatment options, what tends to be the length of time that people would expect to go and see a counselor or a therapist for going through these different modes?
Definitely. So if I will start and focus mostly on the exposure-based therapies, because those tend to be very protocol oriented, and they have a start and a stop. There are some which are more open-ended and depend on the progress between the behavioral health provider and client or patient, and how things are going and how complex the trauma is also. So a factor to consider is that when you have ongoing traumas or when you have complex traumas, there is more time that might need to be taken just because of the complexity of the trauma. If we're talking about a trauma that is like a one specific trauma, and you're doing a exposure-based protocol, this can be somewhere in the range of 10 to 15 sessions typically. So there has been research around success in that number of time, which is pretty hopeful from a behavioral health standpoint. That's a pretty concrete and hopeful thing to hear, because that means that this trauma that you're dealing with, it's possible 2 to 4-ish months that symptoms can be relieved, and can be you can get back to a better level of functioning. So that's really hopeful. Keep in mind, though, this depends on the complexity of the trauma. So there are some protocols where you start on one trauma specifically, you work through that one, and then, okay, that's the conclusion of that one. Now let's go on to the next trauma. Typically, when that happens, it's a shorter time period for the next and following, because you have kind of a waterfall effect and a generalization of these skills into other aspects of your life. So also keep that in mind when you're thinking about it. It doesn't have to be overwhelming. Oh my gosh, it's going to be 15 sessions for each trauma, and I've had like 9 traumas. It doesn't have to be something that can be so overwhelming, such as that.
Yeah, that's interesting. I want to ask a different question related to that, because one of the things that we notice in research and you notice in practice is that PTSD tends to come along with some other things, right? So our term that we would use is comorbidity, right? So when one thing is present, you tend to see some other things. And I'm wondering how that affects treatment protocols. So if someone is, say, struggling with PTSD and also has depression, or someone who has PTSD and is, has a substance abuse disorder as well, how does that kind of influence things?
Absolutely. That's very, very common, that you have comorbidity with different disorders, especially disorders such as PTSD, because there's an avoidance piece. So typically the way that avoidance is expressed is like a substance use disorder or things like that. I see a lot of sleep issues, along with not just PTSD, but many, many different disorders. Um, and in treatment, what we tend to do is we look at what you've got, we break it down, we say, okay, what's going on and what is impacting what? Because sometimes, for example, sleep is a big one that I see all the time. If you have a sleep disorder, say you have insomnia, and you're also dealing with a trauma, what what I tend to do is I will prioritize the sleep so that we can knock that out, because when people sleep better, they're so much has changed from that. When you're getting better sleep, a lot of things are easier to deal with, and you have the cognitive bandwidth to deal with different trauma and things like that. Different behavioral health providers are going to have different opinions about which to do first, and it depends on the impact of the person's life on the person's life and what's kind of going on in their context, and even what they're able to tackle first. So you may have situations where different providers are going to prioritize treatment for different disorders based on that, things such as that.
Yeah, no, that makes sense. But I think it's worth thinking about, because as people are deciding, hey, this is something that I want to seek treatment for, let me be ready to talk about not just the PTSD, but other things that are impacting that as well, or other areas of my life that I feel are being impacted as well. So I definitely want to make sure that we spend some time talking about post-traumatic growth. I know we've kind of hinted at it throughout this interview, and I think it's such an important thing to shine the light on, because it is this other side of the coin. It is this other part of the spectrum that really doesn't have a lot of awareness about it. I mean, even in conversations with peers, colleagues, like people within our field don't always have this concept of post-traumatic growth. And so I think the first important step is knowing that there is this other side of the coin, right? Or there is this spectrum, right? I'm just not shoved into this like box that I have PTSD. And we talked about the range of symptoms. There's also a range of intensity of those symptoms as well. So I first want to pay great homage to Dr. Tedeschi and Dr. Calhoun back in the early 90s at UNC Charlotte. They are really the folks, the clinical psychologists, academic researchers who have really given this concept a name. And their definition of it is pretty straightforward. A positive change experienced as a result of the struggle with a major life crisis or a traumatic event. So essentially, going through something hard, but having a positive spin on it and saying, like, yes, I've gone through that, and that has made me a better person. That has made me stronger. And so they actually have 5 key areas, key elements to what post-traumatic growth actually looks like. So this is something that we have a scale for. We have an inventory. You can actually be assessed on your post-traumatic growth now, which I think is super cool. So the 5 main areas are: 1, a greater appreciation of life. And I think how this shows up is, we see people not taking life for granted anymore, and really like not putting off things to tomorrow, and really doing those things today. That's kind of what that actually looks like. Wed to that, but considered a different category, is taking advantage of new possibilities within their life. So it's kind of like, oh, wow, like I've gone through this really like difficult thing. Time is limited. So what is it that I want to get of what's important to me? What do I want to put my valuable time towards? And that might be something new and different. So a lot of times when people go through something hard, you might see them like have a shift in their career or have a shift in their hobbies. That can be an indicator of post-traumatic growth because they're deciding this is what's important to me. This is what I want to give my time to now.
Yes.
Relationships with others are increased. And I think this makes a lot of sense. We talked a lot about the importance of social support along the way, but people also describe just that that connection is stronger with those that they care most about. And I think another thing that was really interesting that I read about was having a stronger connections with others who suffer. So there's also this like comfort in sharing. There's this comfort in being vulnerable, and being around that community is enriching. And I thought that that was a really beautiful thing to also highlight. I mentioned earlier, there's this increase in personal strength, an increase in confidence. Like if I can go through that, I can go through anything. Mm-hmm. So you see this, we also call it self-efficacy, right? So this ability to like take life on and just feel more grounded. And then the last piece has to do with spirituality and religion and this greater sense of purpose and like strengthening in their belief system. So if any of that is resonating with people, I mean, these are clear indicators of post-traumatic growth. And I did a little bit more research because I figured there might be like a natural pop-up question, which is like, well, what tends to orient people towards post-traumatic growth? So interestingly, people that are extroverted tend to line up with post-traumatic growth. And I think this makes sense because if you think about the willingness to connect with others and relationships being so important, if you're more outgoing, if you're willing to share what you're struggling with, that will lead to post-traumatic growth. There was this openness to experience. So that willingness to kind of reassess, what's important to me and to think differently about life is what leads to post-traumatic growth more likely. And then optimistic thinking and having like hope and future-mindedness, which again makes sense for post-traumatic growth. So this is based on research. This is what's kind of based on science, but I'd love to hear from your perspective, Aimee, like the application side, like how does this show up? Where do you see this?
Absolutely. So something that is really important that I see after a trauma or after some kind of a big stressful event is that leaning on the social support system. So the way that your social support system receives you after that trauma is very telling of your recovery process. So I see so many people who afterwards coming to me saying, look, I tried to talk to my social support system, so and so and so and so and so and so, and they don't understand. And I feel so alone. I feel so isolated. And that difficulty to talk about it and to discuss it and to kind of get some warmth from those around you, that's something that can really isolate people and then really puts a buffer on this growth post-traumatic growth. And so that's something that's really important that I see a lot. And also, I think that coming out of different traumas and different stressors and coming out of it and seeing, hey, I am able to survive. That was the scariest thing of my life. And I survived. I'm still standing here. And having that perspective on it can really assist people in that growth because it gives you a new lens on life. It gives you a perspective of, hey, like I am a strong, competent individual and I can do this. And having that belief about yourself and that strength to get through it, that's something that really helps. Also, I do see a lot of people who have feelings of guilt afterwards that they can't recover or that they're not strong enough to get through it, things like that. And something that I do want to say about that is a lot of times you have to give it time. So your brain, if you think about it like a computer, it has a processing speed. So your computer has when there's some kind of an input, it takes some amount of time before it can give you what you're looking for. And we're not quite computers, because computers these days can be really, really fast, or they can be really, really slow. It just depends. But your brain is its own special, unique computer, and it needs that processing time in order to arrange and kind of categorize what just happened to you and move along from it. So sometimes you just have to give yourself time, and then we do see that post-traumatic growth. Other times, if you need some assistance in categorizing it and then moving on from it, that's where treatment can come in. And then that's where you can get that assistance in categorizing these things and assisting your brain in that. Because sometimes there's a little glitch or a little hiccup that we get just stuck on, and we need that little extra assistance to box it up in that file cabinet that it needs to get into and then move along. So that's what I have to say about that.
Nice. Yeah. And before we close and kind of wrap up this really amazing conversation, are there any other words of encouragement or anything that we didn't cover that you think is important before we conclude?
Absolutely. Just a very, very big warm thank you to those first responders, because you are doing an extremely difficult job all the time, and especially these days, and especially in our current situation. And do not be afraid to lean on your social support system, but then also reach out if you need to, because you are doing a very, very difficult job. And a lot of times, the people who have the hardest time reaching out for assistance are the caregivers, and are the ones who are taking care of others and who are doing these difficult jobs. So I just really, really want to encourage you, if you need that support, definitely get it, because you can't take care of others if you're in a position where you're vulnerable. So to get yourself as strong as you can be, get out there and get that assistance so that you can be there for others if you need to.
Awesome. What a super powerful message. And we talk about a lot of times is, put the mask on first before you're helping other people. And I think that's such a difficult thing for people to do, especially when they're in a field where others come first. But in this case, really, in order to do your job at your best capacity, we have to take that time in order to put that oxygen mask on ourselves. So thank you for that reminder. And thank you so much for your time and your insights and your experience with this. So thank you for having this really interesting and in-depth conversation about post-traumatic stress disorder and that potentially leading into post-traumatic growth. It's been so great to interview you. And thank you again for your time.
Of course. Thank you so much. It's been great to be here. And thank you so much for addressing this topic.